Now let's talk about the abnormal breast cancer genes. Some you mentioned, some we're very familiar with. They shed a light. Angelina Jolie had the BRCA1, and I think people started talking more about it. Then we had BRCA2, and we have POLB2. So what are these genetic these strands that you're talking about?
So yes, so when we talk about genetic mutations, what we're talking is what we know so far. So as far as genes is a small, very tiny component of your whole DNA structure. It's what makes you. So there are certain genes that we know if you ended up having a mutation, that carries enough risk for breast cancer and some other malignancies for you to consider action. Right. Action in prevention more so than early detection. Also early detection as well, but to be thinking about how can we prevent this mutation from becoming cancerous again. Now, knowing it all, I don't think we're there yet. So there is the environmental factors. There are other genes that we don't know. There's connection between genes that we don't know. So that doesn't mean that if you test genetically negative, that we can rest assure you that you will never have breast cancer. And the opposite is true too. Not everyone that has the mutation means you're gonna have cancer. It's just that the risk goes higher.
But now, why is it that some women get tested and they find out they have these genes and they have a high risk for breast cancer, and then they decide to do a double mastectomy?
Yeah, so obviously, since cases like Angelina Jolie that have made this more publicly available, you know, there's more consciousness about doing what we call risk reduction surgery. So get a double mastectomy before the event of cancer. And that has led to pretty much not hearing from that event before to now all of a sudden everyone wants to get it done. And so where do we find the middle term? And I think the recent statistics shows that actually, for example, for breast cancer survivors that can get away with just either a unilateral mastectomy, so the site affected only, or a lumpectomy, often than not chooses to do double mastectomy not to deal with the problem ever back again. Right. And I think it's our job to actually educate and provide the tools statistical tools that proves that in most cases you don't necessarily need that, even if you're a breast cancer survivor. Right. But obviously, this has to be in consideration with the patient's wishes, right? If they don't want to hear of a mammography ever back again, they don't want to just go through, obviously, the whole process of screening back again, then certainly that should be considered.